Hello, I'm Dr. Brandt Gibson, and today we're going to talk about Tailors Bunion. The bad news is I still don't have a foot model. Hopefully tomorrow, when I'm back in the office, I can actually use a foot model, and I will show you an example of what a bunion is, what a Tailors Bunion is, as we talk about hammer toes at that point. So, if you remember, yesterday we talked about a bunion. A bunion is actually where the first metatarsal is curved out and the toe is turned in, which causes a bump on the outside, the inside of the foot by the big toe. The Tailors Bunion is the opposite. It's exactly the same thing. It's by the little toe, or the fifth toe as we call it, and it does the exact same thing, where the fifth metatarsal turns out and the toe turns in. The kind of help you get oriented a little bit. The big toe is the toe number one. Then as you go across the foot, you're counting. So you go 1, 2, 3, 4, 5. So the little toe is number 5. And if you have it the same location, right, the base of the toe, where there's a bump on the outside of the foot, that's a Tailors Bunion. Good news is typically Tailors Bunions don't cause as many of the symptoms as your bunion does, because when we walk through the big toe. We don't walk through the little toe in most cases. So it's not as big of a problem, although it can still cause as much pain, can still cause as many limitations. How is it diagnosed? The same as a bunion is. So you're going to actually do an x-ray, you're going to evaluate it and say, okay, is there a prominence there? Is there a malformation of the fifth metatarsal in that area, or the foot in that area, so that it actually causes that Tailors Bunion? If there is, you can actually say, okay, I'm going to go treat the Tailors Bunion by padding, by wider shoes, by things like that, similar to what we were doing for a bunion. Or ultimately, to solve the problem, you can actually do surgery. Now, spacers in the fifth toe don't work as much as they do in the big toe. Splints and padding and stuff like that similarly don't quite work usually as much on the Tailors Bunion as they do on a bunion itself. So with the Tailors Bunion, surgery is the best option. Typically, we can do a very similar surgery where we're taking off the prominence, moving the bone over, and actually fixing the problem. So if you have a Tailors Bunion and it's interfering with life, so it's hurting enough that it's causing you to be interfered with in the things that you're trying to accomplish, things you're trying to do, it's worth considering doing surgery for Tailors Bunion as well. Disadvantage of the Tailors Bunion, because it's a smaller bone, because it's a little bit slower healing, not as stable. Usually we limit you a little bit more, and we don't get you back to normal activities as quickly as we would, say, for a bunion. Bunion or Tailors Bunion still takes 6 to 8 weeks to completely heal, but we want it stable enough that when you're walking on it and using it, you're not causing additional damage. So, Tailors Bunion, it's diagnosed by symptoms and x-ray. It's treated typically by surgery. Most of the other things don't work, although you could do cortisone shots, you could do some of those other things temporarily, but they're not going to fix the problem. And recovery is a little bit harder for Tailors Bunion than it is for a bunion itself. This is Dr. Brandt Gibson, and this is Podiatry Tip Day number 19, Tailors Bunion. Tomorrow we will talk about hammer toes. Hopefully we'll have a foot model and we can kind of